Live.
Okay.
Yes. And I think we're live. So welcome. Welcome, everyone. Just waiting for people to get in. There's always a certain delay.
Yes.
So just need to be a bit patient. Welcome. Hi, everyone. Come and get cozy with us. I hope you're feeling well for another day where we continue to explore the issue of lifestyle oncology. Welcome, welcome. We'll wait a few more seconds just to see who's joining today. And if you're online, just let us know where you're coming from and what's your professional background. It's always lovely to hear. All right. So let's maybe start. What do you think, Anabela?
Yes, let's do it.
Let's do it. All right. Welcome, welcome. This is session 3 of our 4-day challenge. We'll be discussing all things lifestyle oncology and lifestyle medicine in oncology. So welcome again. We're super excited to have you, to host you once more. My name is Diana Ferreira, for those who haven't been here. I'm a physician, I'm certified in lifestyle oncology, and I hold a master's and a PhD in palliative care. I'm based in Portugal, and I'm here with my co-host, Anabela Amarelo.
Hi, everyone. I hope you are here to enjoy another day with us of this 4-day challenge. I'm an oncology nurse. I specialized in rehabilitation and later in the master degree in the same field. And my passion lies exactly in integrating exercise and rehabilitation into oncology and palliative care. So currently, I'm pursuing my PhD in nursing sciences and aiming to advance my research in this field. Alongside with my clinical work, I collaborate with the AIM Cancer Center and ESLO. So I'm here with Diana, and I'm very happy to be with you too.
That's amazing. So we will start with the presentation again today. Let me just organize here my screens. Right. All right. So I'll share my screen. Here we are with lifestyle medicine in oncology. And today we're going to be discussing the core pillars of lifestyle medicine. Foundations for Oncology Support. So this is day 3, as I said. And please, if you just arrived, share with us where you're coming from and your name and your professional background. We would love to hear from you. And if you have any questions during the presentation, also put them in the chat and we'll have a chance to discuss them a bit later. So here we go, pillars of lifestyle medicine, and let's dive in. Lifestyle medicine has 6 recognized pillars. We added a 7th pillar here because it's increasingly recognized. So nutrition is one of the main ones, exercise. Then we have here substance abuse, but I would say it's like toxic exposure. It doesn't need to be abuse. Healthy relationships, stress management, and sleep. And I would talk about circadian rhythms, which is a bit broader than sleep, but yes, it includes sleep. And we will talk again, like I said, about the microbiome, which is an emerging field and that we find increasingly important in people with cancer as well. So we'll start with nutrition. We know at the moment that the risk of chronic disease, including cancer, is associated with an increased high consumption of processed meat. We know that processed meat like smoked meats and sausages, bacon, they're a group 1 carcinogenic according to the WHO. We also have some indications that a high consumption of red meat might induce cancer, although this is there's some discussion in this field, and particularly because one of the things that people discuss and argue is the source of the meat, which is usually not discussed in studies. And then high consumption of sweetened beverages, high consumption of trans fatty acids, and high consumption of salt. But it's also interesting that a high consumption of salt is also associated with high consumption of processed food. So it may be that it's actually linked and it's not only the salt itself. So in terms of what a healthy eating plate looks like, we particularly like this plate proposed by the Harvard University. And it's also a very simple figure or diagram that people can go to when they're preparing their meals. So half of the plate is usually fruits and vegetables. When people talk about or think about vegetables, usually they think green, but it's really about eating. We say eat the rainbow every day. So every color has its benefits. So it's really important to actually mix different types of vegetables. Then we talk about healthy protein. And when you talk about healthy protein, we talk about grass-fed meat, wild fish, legumes like beans, chickpeas, lentils, and then nuts, walnuts, almonds, for example, and seeds like chia seeds, sunflower seeds. They're all good sources of protein. And then we have whole grains, brown rice and quinoa are some examples. And healthy oils like extra virgin olive oil, avocado oil for cooking, they're particularly good. And then water for hydration and some teas as well. But when we talk about cancer in particular, people have different needs depending on the stage and the type of treatment. So these needs need to be taken into account. So if we're talking about people having treatment with a curative intent or people with advanced disease, the needs here are very different. And for example, protein consumption should be much higher and the protein requirements are higher than people in the prevention stage or in the survivorship stage. So it's really, these stages really make a difference when we're discussing what to eat, in what quantities, and particularities about food. And then immunotherapy, for example, we now know that having a high consumption of fiber during immunotherapy it has an impact on the outcomes. And we'll discuss that in a minute as well. So the goals of nutrition interventions in people with cancer or survivors is to maintain or optimize nutritional status and metabolism, is to maintain and optimize muscle mass and performance, avoid treatment interruption and dose reductions. We know that, for example, maintaining muscle mass is actually a very good predictor, or it has a great influence on how people tolerate chemo and how they deal with side effects and the impact of side effects. So it also has an impact on how people or if people are interrupting treatments and are having those reductions. So, and then nutrition is really important to modulate response to treatment as well, as I touched on when I was talking about immunotherapy in particular. But in relation to nutrition, I think it's really important to say that it's very complex for many reasons. One is that science is constantly evolving and we have new studies in this area every day. We also have studies with contradictory results. We have many discussions about different things, and red meat being one of them. We have also different types of diet available, and again, every diet seems to be the best at some stage, and that can confuse people. Then the food source is important and often overlooked in studies. So that's something we need to consider as well. And the person's context is important. If we're going to propose a diet, we really need to take into account, for example, the family life, how that diet will fit with the family schedule. That's all super important. Then we talk about physical activity, which is the second pillar. We know that cancer has been linked to physical inactivity. Actually, multiple types of cancer, and here are the most common examples: breast, kidney, endometrium, stomach, colon, bladder. All of these have been associated with physical inactivity. And there is a dose-response relationship, meaning that people who work out more, they have better outcomes. So it's really dose dependent. I really like to present these graphs, and they're really simple, but they were published in the Australian Journal of General Practice, and they give you a hint of the impact exercise can have at all stages of cancer. In a cancer journey, basically. When we're talking about cancer recurrence, if we compare the group that exercises the most with the sedentary group, we can have a decrease in recurrence of up to 35%. And that goes for cancer mortality. This difference is even higher. We have 44% risk reduction, and all cause mortality, we have a 48%, up to 48% risk reduction. So these numbers, when we're actually discussing physical activity with patients, I think it's really, really key to actually mention some numbers, because even when people hear that exercise is important or physical activity is important, they hear something like go and exercise because it's good for you, but this is actually high. I think it's really useful to understand the true impact of having a good exercise routine. And then we have evidence for improvement of side effects of treatment for physical activity as well. And we're talking about fatigue, we're talking about quality of life, performance, anxiety and depression, lymphedema, which is something that creates lots of questions in people's minds, and there's some myths around not being able to exercise if you have lymphedema, which is absolutely not true. And then bone health and sleep. And these are the results of a study of participants with metastatic breast cancer by level of physical activity. And it's just meant to highlight that even people with advanced disease derive benefit from physical activity. So, of course, it needs to be adapted to their needs and their limitations, but it doesn't need, they should stop exercise. And when we compare, for example, the group doing light physical activity with the group doing vigorous physical activity, we understand that survivorship is different at 2 years. So what are the international recommendations for cancer patients? Well, 150 minutes of moderate physical activity or 75 minutes of intense physical activity a week. And if we go with 150 minutes of moderate physical activity, it's actually half an hour, 5 days of the week. So it's reachable. It doesn't mean that all people will start with this. We need to sometimes increase up to this. But still, in many people, it is achievable. And then resistant training, one of the best tools we have during treatment, twice a week, keeping muscle mass, as I said before, is one of the greatest predictors of not having to decrease chemo doses. And then flexibility training, we don't talk a lot about that in the oncology training, but I think issues like fascia are quite important, and we'll hear more about that in the future. But the key elements are still the moderate physical activity and resistance training. And then balance training at least 3 times a week. And this is important in older patients, but also patients, for example, during corticosteroids, which really can make your bone really frail. And balance training help to keep your bone healthy and more resistant. And this is just a curiosity, and this basically tells you differences in physical activity levels by country, not in the oncology population. This is overall view, broad overview, but this is to say that at least in Portugal, we don't have the culture of exercise. So it becomes, it's more challenging actually to get people to exercise to the degree we want. We really need to build up to that. And for example, if I look to countries like Australia, the degree of physical activity is higher than here. So it's embedded in the culture, and it's actually easier to build up to that. So avoiding toxic exposure, I think alcohol and cigarette smoking is probably the basic topics to talk here. In terms of alcohol, alcohol is responsible for more than 10% of all cancers. The recommendation currently is to stop drinking. So back in the days, we would recommend 1 glass of red wine a week, or once a day sometimes. So this is not really the recommendation at this stage. Any sort of alcohol it can cause harm. And then cigarette smoking. I mean, cigarette smoking is responsible for 87% of all lung cancer deaths, 30% of all cancer deaths. And there's a trend towards smoking electronic cigarettes at this stage. But we have documented lung injuries. We really don't know what's the impact long term. So it's not recommended that these type of cigarettes will replace the old ones. But toxics are really everywhere. So we have, for example, pesticides and and there's some behaviors we can adopt to sort of protect ourselves from these. Washing fruit, for example, and vegetables, peeling them could be an option. Removing the skin of fish and meat because they sort of more contaminated as well, and eat a variety of products so you're not exposed to the same contaminants over and over. There's a list as well. I know there's a list in the US of the Dirty Dozen and the Clean 15, which kind of gives you an indication of what type of produce you should aim to buy organic. It could be helpful to make decisions on a daily basis. And then phthalates, these are in plastic containers, in detergents, in hair care products, perfumes, so in different daily products as well. Simple behaviors to adopt is to replace plastic containers with glass containers, avoid using plastic. I would say avoid using plastic in contact with food, but especially if you're going to microwave or heat up food, and avoiding products with fragrance or perfume, because labels are not actually obliged to disclose what type of components are in fragrance. So yeah, that's one of the key issues as well. So then we have flame retardants, and these are in insulation materials, in cars, in electronic equipment, and in many things around the house. So it's actually quite difficult to avoid them. But again, there's certain behaviors we can adopt, like cleaning dust with a damp cloth or mop, a vacuum with HEPA filters, and wash your hands before eating, and avoid furniture and toys with this particular foam. BPA, you might be familiar with that. It's usually in plastic bottles, so that's the where we're used to seeing it, and but also receipts and cans, for example. So we usually recommend to reduce canned goods and wash food well, avoid plastics, and buy BPA-free bottles. And here it's important to understand that there's some replacements for BPA, and we're actually not sure if they're better, like BPF is one of them. And then PFAS. PFAS are spread as well in anything from waterproof clothing to pans and pots that are non-sticky. So avoiding frying pans and pots made of non-sticky material, that's one of the indications as well. So we'll talk a bit about circadian rhythms. A circadian rhythm is a variation that occurs within a 24-hour period. And we see them in the planet, for example. We know that light has a cycle within the 24 hours, and the same with temperature. And we're sort of the same. We sort of mirror these changes in the planet, and we respond to these external changes. And according to the time of day, for example, our gene expression is different, our physiology is different as well. And we now know that the disruption of the circadian rhythm is associated with increased cancer risk. And this can happen, for example, with shift work, with long trips, and if we live in the westernmost part of a time zone, because there's a later dawn, there's a later dusk, and that tends to disrupt our circadian rhythm. And during sleep is a really, really key aspect of our lives, because that's when the body regenerates and when remodeling and DNA repair happen, and when anti-inflammatory components like cytokines are produced. And we know that lack of sleep, and it's usually less than 7 hours for most people. We know that there's a suppression of melatonin production and a suppression of the immune system. There's a pro-inflammatory state, there's cell cycle dysfunction, and there's a decrease in removal of neurotoxic products. So sleep is really key to maintain a healthy balance in our body. And a lack of sleep was associated with different cancers. So simple steps for sleep regulation, and I think they should be proposed to every person with cancer. Increasing exposure to sunlight, early morning and sunsets, and this is not through your skin, but just having exposure your retina to sunlight. Set up a wake up time and a bedtime, because we really don't compensate changes for each day. So we can compensate for differences in schedule of about 15 minutes a day. More than that, it's actually quite hard for our system. And then increasing physical activity during the day, increasing peripheral vasodilation, and this can happen with a hot bath, for example, socks, hot drinks, good hydration, decreasing activity just before bed, and turn off unnecessary lights at night, eliminate screens, which people are more familiar with. And then in terms of stress management, we know that there are some non-pharmacological interventions for managing chronic stress. Acupuncture is one of them. Then we have breathing techniques, which is basically any technique that prolongs exhalation, activates the parasympathetic nervous system, and reduces stress in the body. And then different types of movement like yoga, physical activity, Tai Chi, Qigong. They're all good ideas for people. And then I think it's usually useful to have a creative outlet. It could be anything, but it's a moment where people are immersed in something other than their disease. So it can be quite helpful. And then activities with a good community support, and even volunteering can be really helpful. Then healthy relationships. I don't think we pay close attention to healthy relationships. And this was a really interesting study that sort of measured the degree of happiness and how that influenced our people around us. And it's really interesting to notice that happiness or unhappiness is contagious up to 3 levels of separation. So if I'm happy, I can influence the people I have contact with, and they can influence other people, and these people can influence other people. So the reason I like to present this study is that we as health professionals really have to think the impact we're having when we're talking to patients, and the impact we'll have in their lives, in the lives of people around them. And we really don't have a sense of how important that could be for people. And then there's 2 types of relationship. We have more social emotional relationships. These are the type of relationships we have with people closer to us. And then instrumental relationships. You can have these, it's basically when you go outside, go to the grocery store, and you see a few people that you actually don't know, but you have small interactions with them. And both were associated with increased longevity, reduced age-associated cognitive decline, increased resistance to infectious diseases, and a better prognosis in chronic diseases, including cancer. So the recommendations here are micro moments of connection, especially when people live alone and don't have any support. Even getting out of the house and seeing people can be really helpful. Support groups, groups of people with similar interests, and encouraging patients to actually establish positive relationships. Just very briefly, we touch on the microbiome. And two concepts I would like to bring in today. The microbiota is actually the set of microorganisms that colonize different body regions. So we have different microbiota, depending if you're looking at the mouth, for example, or if you're looking at the gut. The microbiome is the group of microorganisms, but also the genes of these microorganisms. And this is important because the expression of these genes can vary quite a bit. The impact of the microbiome on the pathogenesis of cancer and the results obtained with treatment is increasingly recognized. And we briefly mentioned that in the first presentation when we talked about the hallmarks of cancer. So these type of cancers, colorectal, gastrointestinal, oral cavity, etc., they were associated with the disruption in the microbiome. And the important thing about the microbiome is that they can modulate the hallmarks of cancer, and they can modulate different hallmarks. So they can, for example, specific types of organisms like E. coli can actually sustain proliferative signaling, while other bacteria like bacteria producing butyrate, for example, it's able to sort of balance cellular energetics, and we have a chance of acting in the gut to actually tip the balance to a more favorable one. And this is a study of 128 participants with melanoma who were treated with immunotherapy. And here there was an improvement in disease-free survival with adequate dietary fiber intake. So when people are taking immunotherapy drugs, it's really, really important to optimize their fiber intake and their nutrition. And this is, of course, a really brief overview of the lifestyle factors and their importance in the oncology field. But if you want to learn more, we have an advanced certificate in lifestyle oncology starting in February 2025. So you're more than welcome to go to this to our page, which I put here in the screen. This course is supported by MASK. That's plus. And then it has a 3-month duration, completely online. Most classes are recorded, so you can do it at your own pace, and we'll have multiple guest lectures. The course is tailored for health professionals, but everyone is welcome. And you will learn, so there's 12 modules, you'll learn lots of different things, many concerned with the lifestyle factors we just discussed. We'll go into detail about that. So it would be really wonderful to have you with us. And I'm going to stop the presentation now. Today was a bit longer than yesterday. So here we go. All right. So we're back here. And I think Clarissa, our guest today, should be on the line. Hi, Clarissa.
Hi.
Welcome.
Hi, everyone. Hi.
Welcome.
Thank you for having me.
Yeah, it's a pleasure to have you with us. So I'm here hosting with my colleague Anabela. She's an oncology nurse, so we'll be chatting all
Clarissa.
Lovely
together.
to meet you both.
Great to be with you too.
Thank you. It's an
So
honor to be here.
thank you, Clarissa. So I would like to introduce officially Clarissa Husser. Clarissa was born and raised in South Africa, where she pursued a career in graphic design. Her adventurous spirit led her to relocate to the US, where she met her husband and dedicated 18 years to raise their children. Following a decline in her health after immigrating, Clarissa developed a passion for health and wellness. And after several health challenges, she received an aggressive cancer diagnosis in 2023. Undeterred, Clarissa immersed herself in research and advice from integrative oncologists and was able to overcome cancer. Now she's dedicated to help others in their healing journeys. Currently studying to become a cancer coach, Clarissa aims to empower individuals to reclaim their health. Amazing. Welcome once more. And
Thank you.
I would like to start by asking you if you could tell us or share with us about the moment you knew you basically were told you had cancer and what was the experience like.
Yes, again, thank you for having me. And it's a true honor to be here. And I just love what you're doing here. I think it's fantastic. Um, when I first received a cancer diagnosis, there was just a whirlwind of emotions. Initially I just had complete shock. Because I was misdiagnosed for 3 years, that I was misdiagnosed as a fibroadenoma. And so cancer was never on my radar. I was monitoring it every 3 to 6 months, and it just wasn't what I was expecting to hear. And after 3 years, we decided to remove the fibroadenoma, and then that's when, we realized it was cancer once pathology came back. And when you hear the word cancer, you feel completely numb. I remember just breaking down in tears and just thinking, how could this happen? I really try to live a holistic lifestyle, and I get like emotional thinking about it now, because it's just, you're like, I don't even know what I could do differently, because I've tried to live such a clean lifestyle. But looking back, I realized I wasn't doing everything correctly or what I should have been doing. And so, it was a learning process. But my emotions were just all over the place, from fear and anxiety to denial. And I just kind of felt like my world was at a standstill, and I was just disoriented and just hard to process the shock. But eventually, I did reach acceptance, and I gradually began to, kind of think of what my next steps would be and reevaluate, and just trying to shift my focus into, okay, what can I control? What changes can I make? And this, shifted my emotions to a sense of empowerment almost. And it kind of a spark ignited within me. And I realized I do have the control to take care of my health. And so I was determined. I'm like, I'm going to learn more. I'm going to find answers, and I'm going to take actionable steps. And so I really, I had a deep desire to heal. I knew my body could heal. And I really wanted to get to the root cause, like, why did this happen, and how can I fix it? And so initially I connected with other cancer survivors, and I immersed myself in books and podcasts and research. And then I also worked with some of the best integrative oncologists here in the States, and I was able to build a more complete picture of how to heal my body, and just really support its natural ability to heal.
Amazing. Thank you.
Thank you. So, Clarissa, I was thinking in that experience, how was your connection with the conventional health system? What was your experience in that field?
For me, I think it's going to vary from person to person based on your personality. And I greatly respect all the doctors I worked with, but I did feel like I was left with a deep sense of just disempowerment. I was told, it's bad luck. There's nothing you can do. Go home and drink a big glass of wine. There's nothing you can change. And I had, some concerns, and they seemed to be dismissed, because I was already starting off with a low immunity. I had low white blood cells, and I had weight loss. And, I felt like those concerns were, unheard. And and I also felt like there was a little bit of a lack of a holistic approach. And so I love what you're doing here. There was a heavy focus on just medical interventions, and no conversation at all addressing, the factors that might have contributed to my diagnosis. Perhaps exploring underlying root causes, like you mentioned earlier, toxic overload, chronic infections, also genetic mutations. How's your diet? How's your lifestyle? What are your environmental factors like? And so I just felt like it was lacking that.
Mhm.
And the other thing that I felt was that there was just an overemphasis on statistics. When I walked in to the oncologist's office, I felt like at that point a number. I was a
Yes.
one size fits all. I put you in the box, and this is the approach that you get. And it quickly became like data driven. We were going through statistics of survival rates and treatment protocols and outcomes. And then I felt like I'm just reduced to another statistic. It wasn't an individualized protocol for me. And so some tools that I think have helped me have better relationships with healthcare professionals is, interview different doctors. Find a doctor that you connect with, that you have a good, your personalities gel. Find a doctor that's open and receptive to other ways, complementary ways of healing, and be prepared and organized. Have a list of questions and go in being open and honest, discussing your fears and your concerns, but obviously being respectful of their time, but not holding back. Don't be afraid to ask questions. Don't be afraid to advocate for yourself. And I didn't do that. I quickly shut down and just withdrew in a lot of those appointments because I felt just this wave of fear. And so, in general, for me, it really opened my eyes to the point to the importance of just really taking charge and regaining empowerment, and just really also exploring complementary avenues that can complement what you need to do to heal.
Brilliant, Clarissa. And I'm curious to know what made you take control of your health, because many people feel so defeated and
Right.
just give their power away completely. And I was wondering, why was it different with you?
Um, I had several motivational factors. I think the biggest one was like I don't like to be out of control, and I felt like I was spinning out of control, and I also felt like I know my body better than anyone. I'm starting with a compromised immunity, and I had a feeling that the treatments offered just I don't even know if I would have survived them because they were so aggressive, for my body weight and for low white blood cells and everything. And I just, the other thing is I really witnessed a lot of loved ones fight and bravely fight, truly battle to achieve remission, and then only to, face the devastating reality of metastasis or resistance to medications. And, I also had to face the harsh reality of saying goodbye to loved ones who lost the battle and did everything they were told to do and more. And unfortunately, we had to say goodbye. And so, these were major concerns for me. And, the side effects as well. I didn't know how my body would respond to some of the side effects, and I couldn't really come to peace with that. And so that really sparked a desire for a personalized, more tailored approach to address my individual needs. I feel like every person, every cancer patient, every body is different, and there needs to be a tailored approach to your metabolic type and to your body and what you're dealing with, what you've been exposed to. And so I knew, okay, there has to be a reason. I had this innate belief, that our body can heal, and I knew my body had the ability to heal. After all, my body created the cancer. Surely my body can heal it. And so, that really made me question a lot of things. And one of the things I questioned was, is cancer truly the enemy? Do I have to go to war? You think of you think of cancer and you automatically think of war analogies, like fight and battle and enemy and warrior and conquer and attack and kill and poison. And it's very aggressive language towards your own body. and that also brings fear, and it kind of paralyzes you. And so, I knew who the author of Fear was, and I was determined to follow peace. I allowed it to be my North Star, and I changed my language I never, use those terms. I changed it to heal, my journey to health, healing the body. And I don't know if you've heard of her, but on my journey, I was fortunate to discover an amazing doctor. Her name's Dr. Jen Simmons, and she's all over Instagram. But she's a breast oncologist surgeon, and she transitioned into functional health. And she had the most beautiful analogy in her book that I read, and it changed my entire thought process. Her analogy was comparing our body to a proverbial sink that's kind of overflowed. And she explains how conventional treatments are helpful to mop up the floor and clean up the mess, but doesn't turn the faucet off. What is, and that fueled my quest. What's this burning desire? Like, what's the root cause? How do I turn this faucet off? What's wrong with my terrain? The inner states of my environment. Pardon?
Yeah, go ahead.
So, I wanted to understand, like, do I have an acidic environment, a poor oxygenated environment? Am I dealing with chronic inflammation? Nutrition deficiencies, dysbiosis. And so I realized that I needed to develop a more personal approach that was unique to my terrain, something that was curative, merely than just addressing the symptoms and mopping up the floor.
So I'm understanding that in fact you incorporate lifestyle changes in your life. Can you talk about that a little bit more, please?
Yeah, sure. So I absolutely, definitely, I didn't just incorporate them. I did everything that I could possibly do as fast as I could do. There was so much I learned, and I'm just going to briefly touch on them today for, time's sake. But my journey did incorporate many holistic health practices, which, as you mentioned, like are pillars, aside from repurposed medications and intravenous modalities. But, my focus was just getting back to the basics, creating an environment that supports your body's ability to heal. So I quickly learned the statistic that 95% of cancer is actually driven by environmental factors and lifestyle choices. And only 5 to 10% of that is genetic mutations. So, this insight changed everything for me. And I knew that I had to change how I lived, how I ate, how I took care of my body. Even the products, like you mentioned, what you're putting in, on, and around you. And so the very first thing I did was, change my diet based on a metabolic type. And every human being is different. Some people do well in vegetarian, some do carnivore, some do a mix. So that was probably the biggest shift, is like finding out what my metabolic type was, what I do best, what diet does best for me, and what diet does best for the type of cancer that I have. I have a breast cancer, so it's primarily fed with glutamine. So just making sure I, kept that in mind, and just focused on nutrient-dense whole foods. Like you mentioned earlier, going back to clean, organic, eating the rainbow, having a balance, and just enjoying all the colors of the foods, and avoiding these processed foods, these processed sugars, these seed oils, which are extremely high on omega-6s, very low in fiber. And omega-6s then become the problem. They're very pro-inflammatory by themselves, and they have these unsaturated bonds. And then when you heat them to high temperatures, it makes this trans fat, which causes oxidation in your body. And so you're dealing with just high inflammation, chronic systemic inflammation, when you have a higher ratio of omega-6 to 3s. So I changed that up and try to make sure I incorporated more omega-3 rich foods to lower the inflammation. And I did eat some grass-fed meats and some organs, but it wasn't, all I ate. I ate the rainbow. I juiced. Anything that was created for us to eat, I enjoyed, as long as it was clean and organic. And I naturally, that also naturally leads me to hydration. making sure, you know, you filter your water and you have good mineral rich water that you're drinking, you know. So hydration is so important. I use soursop tea or SCI tea or like rooibos. I heard a South African on the line earlier, so he'll know what that is. The next thing I took a deep look into was like my environment and my personal care products. You know, I examined my home. Do I have potential toxins in my home? Do I have chemicals? Have I been exposed to mold? And if so, that's going to change how I'm going to detox. And I threw away all of my non-toxic personal care products. I just got rid of them. I avoided products, you know, that had endocrine disrupting chemicals like your fragrances, your cleaning supplies, and like you mentioned earlier, plastics as well. You know, there's a shocking statistic that females put on around 200 chemicals a day on their body, and that does include, you know, the VOCs we're exposed to and the chemicals in the air and in the water. So, you know, knowing that, I made a conscientious effort to just try to do better and, you know, just make better steps each and every day. And you know, I got rid of all the plastic in my kitchen, and I opted for glass and stoneware and stainless steel. And I used to drink out of plastic water bottles. You know, I cut that out straight away, knowing that that can leach chemicals, you know, into the water. And um, and then I incorporated detoxification practices. You know, detox was about creating the right environment in my terrain so that my body could heal. You know, and the first step is making sure your detox pathways are open, because if they're not, these toxins that you're detoxing are going to just circulate around your body and make you sicker. So you have to make sure your detox pathways are open firstly, and so that is focusing on sweating. Are you eliminating correctly and enough? You know, are you hydrated, eating enough fiber? And you know, I also found out that through a simple lab test that I have the MTHFR genetic gene mutation, which, you know, played a significant role in how my body detoxes. And so this mutation made it hard for my body to eliminate toxins naturally, which is, you know, it's important. I think people need to know, how does their body detox? And so I had to force detox. You know, I have to, and I still do. I use infrared sauna cocoons, do enemas, lymphatic massage, dry brushing, try to have a diet rich in fiber. And, you know, the deep box breathing is really helpful for detoxification, as well as exercise, you know, through movements and sweat. And, you know, to complement all of that, I really focused on the connection to nature. I focused on sun exposure and vitamin D, watching the sunrise and the sunsets, as you mentioned earlier. You know, we don't do that now. We're stuck in homes, and we're so disconnected with our shoes and our homes and our cars. We don't often touch the earth, you know. So it's really critical for our immune function and for cancer prevention. And most cancer patients, you know, I've learned, are deficient in vitamin D. My levels were sitting at a 20 when I was diagnosed, and I didn't, you know, I'd never thought to check my vitamin D levels, and I didn't know that there was a link between low vitamin D and cancer. And so, you know, I worked really hard to get to optimal levels. I'm sitting at 80 now, and, you know, I do supplements, but I try to, you know, get a lot of it from the sunshine. And then, you know, making sure you're grounding and you have that contact with the earth, because the earth carries a negative charge. And so when we ground ourselves outside, our bodies absorb those free electrons from the earth. And these electrons have antioxidant properties, and they really help neutralize our free radicals. And that helps, you know, reduce inflammation, support our immune system. So I learned, you know, it's really important to spend time outdoors. And, you know, just it had a profound effect, you know, both on my mental and physical health, because being outside just made me happy. And, you know, just being in the sunshine is just so healing as well. I incorporated exercise and movement, you know, while supporting my adrenals. I made sure that I didn't stress my adrenals with too intense exercise, you know. So I established regular exercise routine. I started off with just walking. I did a lot of walking to try to promote oxygen flow, try to reduce stress, try to support my lymphatic detox. And I learned that the simple act of walking just 15 minutes after a meal ensures that the glucose that is used for energy production, it will be used for energy production rather than being diverted to the cancer cells. So that was important to me, to just make sure that what I'd eaten prior is not feeding the cancer. And I did some stretching and weightlifting to strengthen, and I still do, strengthen my muscles and my bones. And then just some very light rebounding to help with lymphatic movement. And, again, different people tolerate different types of exercise and different types of intensity. And for my, metabolic body type, low intensity exercise is much better, combined with mindful practices, deep breathing, and, light strength training. So it's important to know what your body can tolerate. And, I also focused on fasting. I did a lot of fasting. I did intermittent fasting every single day, actually. And then I did some extended fast for autophagy, and just to also try give my digestive system a break and focus more on healing. And I optimized my sleep, made sure I had a optimal sleep environment, the cool, dark room with, try to remove all electronics out of your room. We turn our Wi-Fi off at night. We sleep on a grounding sheet. And then, just focusing on syncing my sleep with the circadian rhythm, as you mentioned earlier, really helps to support your immune function, overall health. Sleep is so essential for healing, and melatonin also plays a role in inhibiting cancer growth. So I knew that prioritizing sleep is a fantastic healing tool. And lastly, just stress management, practicing meditation, deep breathing to lower my cortisol and my inflammation. Just reading books, try to learn more about cancer. I did music therapy, which improved my mood and helped me release happy hormones. And, I sought out positive, encouraging content. If there was something that brought fear or negativity, I kind of closed the door to it and I walked away from it. I learned how to say no, and that's truly a skill, because it's very hard for me to say no as an A-type personality, and I had to really take control of my thoughts and my emotions. And, this journey really has just been about supporting my body and its ability to heal, and just really aligning my lifestyle with these natural processes. And I believe that when you give your body the right tools and the right environment, that our bodies are able to heal. So that was a lot.
Brilliant. That was a lot, but that was really, I think you spoke on the integration of all these different modalities. So it's not only
Right.
going and it's not only changing your food, but it's really a shift in the way you live and the way
Right.
you integrate all these different aspects, and that makes the
Absolutely.
difference. And Clarissa, we don't have much time left, but I really would like to ask you, because this is something that many cancer survivors struggle with, the anxiety of checkups and reviews, and seeing if, when they go to the doctors just to check to see if everything is all right. Many people struggle with anxiety. And do you have any tips about that? Do you get anxious, and do you have any tips on that?
Yeah, I mean, you hear, cancer just in and itself brings such a wave of emotions.
Yeah.
And, that's so completely natural. And it really can. It triggers fear and anxiety and uncertainty. And, some of the strategies that I use to manage and reduce those feelings is just trying to acknowledge my emotions. It's not helpful to suppress them. So you have to acknowledge them, and you can do that by practicing some meditation to just calm your mind and bring you clarity. The deep breathing, back to deep breathing, it's a simple tool, but it's incredibly effective. And using a heat pack, I would get a hot water bottle and I just put it on my chest, and I'll get like a heat pad and put it over my eyes, and I'll just lay with some meditation music or just some soft music, and it really helps bring immediate relief. And, as a cancer survivor, I still find it helpful to connect with others. I think, we can't do it alone. We need a trusted support system. We have to surround ourselves with a team, with other survivors, perhaps, to give us hope, and encouragement, and to have close relationships with your friends and your family. And that's why I started my Instagram account, because I needed a supportive community. I knew I can't do this alone. I needed to have other people in my corner that were going through similar things that we could talk to, and encourage each other and provide a listening ear. And, cancer is so unpredictable and the future is so uncertain, but worry robs you of today's joys. And so you really have to just focus on, okay, what can I do today? What can I control today? And try not to think about tomorrow. And, just try to value also maybe helping others. And, when you take your mind off of yourself, it not only uplifts them, but it also fills you with purpose and a deeper sense of connection. So, it's a powerful reminder of just a bigger picture and, perspective shift.
Thank you so much, Clarissa. I think it was such a interesting and insightful conversation. Thank you for being with us.
Thank you.
We really need to bring this session to an end, but it was such a pleasure to connect, to hear your story, hear your perspectives that can help many people. So I just want to thank you and say goodbye to our guests today, to the people who are watching, and we'll be back for tomorrow's session, which is the last one. And I'll say goodbye for now.
Goodbye.
Thank you again. It was an honor. Bye.
Thank you. Thank you so much,
you.
Clarissa.
You're welcome. Bye-bye.